Hi, my name is Dr. Jalpa and welcome back to my YouTube channel. I'm the medical director and the founder at Klarity Skin Clinic. Today we're going to talk about male pattern hair loss. Let's dive into it. So male pattern hair loss is a very common condition seen in men due to genetic predisposition and hormonal stimulation with a hormone called DHT or dihydrotestosterone. The hair follicles on the scalp start thinning out. Basically, the hormone stimulates the follicles to make them shrink, and so the size or the diameter of each hair follicle starts reducing, leading to increased scalp visibility. You gradually the follicles become so thin and small that you tend to lose them permanently. There are various grades of this type of hair loss. So it begins with a mild recession in the front or sometimes on the vertex. That's grade 1. Grade 1 gradually progresses to grade 8. 8 is when only a horseshoe shaped portion of the scalp has hair left, which means most of the hair in the front is lost. This type of hair loss can begin as early as teenage years or late teenage and slowly, gradually progresses. There are rapid progressors and slow progressors depending on the genetic predisposition. While this condition is very common, there are many treatments available. Treatments include oral medicines like finasteride. Finasteride is basically an anti-androgen that helps to reduce or slow down the action of the dihydrotestosterone at the hair follicle level. So it slows down the miniaturization of the hair follicles. Minoxidil is a topical medicine that needs to be applied as directed by your practitioner or your dermatologist. In most cases, it has to be applied twice in a day. It's a solution that needs to be spread out on all the affected areas. Other treatments include clinic treatments like PRP, GFC, exosomes, QR678. All these treatments are basically aimed to stimulate your hair follicles to produce new hair or to produce thicker hair. These need all the treatments will need to be done on a very regular basis. The gaps between the treatments will depend on the treatment selected by your dermatologist. Even finasteride, minoxidil, as well as the in-clinic treatments, they all have to be done for years, since the condition is progressive, where if you stop treatment midway, from there again the condition will progress, and so the thinning continues. Hence, it's usually required to do treatment for years together. This slows down the progression, but you cannot stop it completely. So after a few years, one may actually need to opt in for a surgical treatment like hair transplant. Hair transplant results are permanent. However, you may still need to continue using minoxidil and or clinic treatments like PRP and GFC to slow down the progression of the rest of the follicles from shrinking or miniaturization. Thus, male pattern hair loss being very common, most men opt in for treatments at an early age and continue to do so for years. Thus, male pattern hair loss needs to be identified early. Treatment started early will slow down the progression and maybe push surgical treatment like transplant to a later stage. While male pattern baldness is mostly genetic, other factors that actually contribute to faster progression or worsening will include certain medical conditions like maybe severe illnesses. However, certain conditions that actually worsen or make the thinning progress faster include medical conditions, chronic stress, nutritional deficiencies. You need to visit a dermatologist who can identify any of these if they are contributors and hence treat them so that the treatment will work more effectively and the progression also is slower.